Hey everyone! High cholesterol is one of the major controllable risk factors for heart disease and stroke, which are two of the leading causes of death worldwide. An estimated 93 million adults in the United States have total cholesterol levels that are higher than recommended. The scary thing is that high cholesterol often has no obvious symptoms, so many people may have elevated levels and not even realize it. That's why it's so important to be aware of some common signs that can indicate your cholesterol may be higher than it should be. Recognizing potential symptoms early on gives you the power to make lifestyle changes and get medical treatment to reduce your cholesterol before it leads to serious health issues. In today's video, I will cover the top 10 signs and symptoms that may indicate high cholesterol levels in your blood. I'll explain these symptoms, how they relate to high cholesterol, and when to see a doctor. I aim to educate you on this important health topic so you can take proactive steps to monitor your cholesterol and safeguard your heart health. Alright, let's get into the top 10 common signs of elevated cholesterol. One of the most visible warning signs that your cholesterol may be dangerously high is the formation of fatty deposits under the skin, known as xanthomas. These deposits appear as yellowish, bumpy growths and commonly develop around the eyelids, elbows, knees, and buttocks. Xanthomas occur when cholesterol accumulates in the soft tissues faster than the body can eliminate it, leading to localized buildups of fat. While they are painless, they can be a sign of severe lipid imbalances that require urgent attention. These deposits range in size from tiny spots to large clusters and can grow over time if high cholesterol remains untreated. Their presence strongly suggests that cholesterol levels are dangerously high, particularly in individuals with a genetic predisposition to cholesterol disorders. Ignoring xanthomas could be risky, as they indicate a more significant problem occurring internally within the arteries. If you notice these unusual growths, it's crucial to consult a doctor and get a full lipid panel test. High blood pressure or hypertension. A direct consequence of high cholesterol is an increase in blood pressure, as plaque buildup inside the arteries reduces their flexibility and narrows the blood pathways. This forces the heart to pump harder, creating more pressure on the arterial walls. Over time, persistently high blood pressure weakens the arteries, making them more prone to ruptures or blockages, which can lead to life-threatening complications like heart attacks or strokes. Many people with both high cholesterol and high blood pressure experience no immediate symptoms, making these conditions silent killers that develop over years. However, some individuals may experience frequent headaches, nosebleeds, dizziness, or shortness of breath, especially during physical exertion. Managing cholesterol effectively through a healthy diet, regular exercise, and medication if necessary can significantly lower blood pressure and reduce cardiovascular risks. Chest pain or angina. One of the most serious warning signs of high cholesterol is chest pain, known as angina, which occurs when arterial plaque buildup restricts blood flow to the heart. This pain can feel like a tightening, pressure, or burning sensation in the chest and often radiates to the jaw, left arm, or shoulder. Angina episodes can occur during physical activity, stress, or even at rest, indicating that the heart isn't receiving enough oxygen due to clogged arteries. If left untreated, cholesterol buildup can completely block an artery, leading to a heart attack, which can be fatal. Anyone experiencing recurrent or unexplained chest pain should seek medical attention immediately, as it could indicate an impending cardiovascular emergency. Rapid heartbeat or arrhythmia. When cholesterol levels climb too high, arteries supplying blood to the heart narrow and stiffen, making it harder for oxygen-rich blood to reach the heart muscle. In response, the heart compensates by beating faster, which can lead to episodes of arrhythmia, where the heartbeat becomes irregular, fluttery, or excessively rapid. Some people may experience a racing heart even when resting, while others feel a sudden strong heartbeat after mild exertion. Persistent arrhythmia increases the risk of blood clots forming, which can travel to the brain, causing a stroke, or the lungs, causing a pulmonary embolism. If you frequently experience unexplained heart palpitations, it's essential to get your cholesterol checked and evaluate your overall heart health. Erectile dysfunction, or ED, is another sign to watch out for. For men, cholesterol-related artery blockages can lead to erectile dysfunction due to restricted blood flow to the reproductive organs. Cholesterol deposits reduce the flexibility of blood vessels, making it difficult for sufficient blood to reach the penis to maintain an erection. ED is often an early warning sign of atherosclerosis, meaning that cardiovascular issues may already be developing elsewhere in the body. If left unaddressed, the same arterial blockages contributing to ED can eventually lead to heart attacks or strokes. Men experiencing persistent erection difficulties should not ignore the issue. It could be a sign that cholesterol levels need urgent management. Numbness and tingling in the limbs is another symptom to be aware of. When cholesterol blocks circulation, blood struggles to reach the hands, feet, and extremities, leading to numbness, tingling, or cold sensations. This is a condition known as peripheral artery disease, or PAD, which develops when arteries narrow due to cholesterol deposits. People with PAD often experience pain or cramping in their legs when walking, as well as slow wound healing due to poor circulation. Ignoring these symptoms can lead to severe complications, including tissue damage and increased risk of limb amputation in extreme cases. Vision problems, such as blurry or double vision, can also be a sign of high cholesterol. Your eyes can reveal a lot about your health, and high cholesterol can silently affect your vision without you realizing it. One of the earliest warning signs is the appearance of blurry vision, double vision, or even sudden vision loss in one eye. This happens when cholesterol deposits form in the tiny blood vessels that supply the retina, reducing oxygen and nutrient flow. A more visible sign is corneal arcus, a grayish-white ring that forms around the cornea due to cholesterol buildup in the eye tissues. Although common in older adults, its presence in younger individuals may indicate dangerously high cholesterol levels. In some cases, a sudden painless loss of vision can occur due to retinal artery occlusion, where a cholesterol plaque blocks blood supply to the retina. This is a medical emergency that requires immediate attention to prevent permanent blindness. If you experience unexplained visual disturbances, don't brush them off as simple eye strain. It might be your body's way of warning you about underlying cholesterol-related blockages. Dizziness and balance issues. Do you ever feel like the world is spinning around you for no reason? Frequent dizziness, lightheadedness, or difficulty maintaining balance could be linked to high cholesterol. This happens when cholesterol plaques clog the arteries leading to the brain, reducing the supply of oxygen-rich blood. One serious consequence of this is transient ischemic attacks, also called mini-strokes, where brief blockages cause temporary loss of coordination, confusion, or weakness. While TIAs resolve within minutes, they are a major warning sign of an impending full-blown stroke. Another cholesterol-related cause of dizziness is low blood flow to the inner ear, which controls balance. You may feel sudden vertigo, nausea, or unsteadiness when getting up too quickly or turning your head. If you often feel off balance or experience unexplained dizzy spells, don't ignore them. It's crucial to get your cholesterol checked and prevent a potential stroke before it happens. Chronic fatigue and weakness. Feeling exhausted all the time, even after a full night's sleep? Chronic fatigue and muscle weakness can be subtle signs that your cholesterol is out of control. When cholesterol blocks your arteries, it restricts oxygen delivery to your muscles and vital organs, making you feel constantly drained. Even simple activities like walking upstairs or carrying groceries might leave you feeling out of breath and weak. The reason? Your heart has to work much harder to pump blood through narrowed arteries, leading to reduced energy levels. People with high cholesterol often describe feeling sluggish, foggy, and unmotivated, as if their body is running on empty. This lack of energy can also be linked to poor circulation, as your muscles don't receive the nutrients they need to function properly. If you're constantly fatigued despite getting enough rest, don't just blame it on stress. Consider getting a cholesterol test to rule out potential cardiovascular issues. Memory problems and brain fog. Ever walked into a room and forgotten why you were there? While occasional forgetfulness is normal, persistent brain fog, confusion, and memory lapses could be linked to high cholesterol affecting brain function. Your brain depends on a steady supply of oxygen and nutrients carried through blood vessels. When cholesterol clogs these pathways, it can result in poor concentration, slower thinking, and trouble recalling information. Studies suggest that high levels of LDL, or bad cholesterol, may contribute to Alzheimer's disease and dementia over time. This happens when cholesterol leads to plaques forming in brain arteries, much like it does in the heart. If you're struggling with unexplained mental fatigue, difficulty focusing, or frequent forgetfulness, it may not just be aging. It could be a cholesterol-related decline in cognitive function. Keeping your cholesterol levels in check helps protect not just your heart, but also your brain. Final thoughts. Take control of your health. And there you have it. 10 warning signs that your cholesterol may be dangerously high. Remember, high cholesterol is a silent threat that can damage your body without noticeable symptoms. The only way to truly know your levels is through a simple blood test. If you recognized multiple signs from this list, don't wait until it's too late. Take action now by eating a heart-healthy diet, exercising regularly, and consulting your doctor about